You have been doing manual therapy for many years. You developed your own program, which you teach across the country, many practices in manual physical therapy, a very effective program, actually. Tell me first, what intrigued you in getting involved in electrodiagnostics to begin with?
I was doing a sports clinic with a local orthopedic, and we were doing musculoskeletal ultrasound. So essentially, these athletes would come in, I'd do an orthopedic exam, and the physician would do musculoskeletal ultrasound. And then, depending on what we saw, then I would go ahead and treat that patient like right away with some hands-on spinal mobilization. We'd get the athlete back onto the field super quick. Very busy. We had a good sports clinic going, and then all of a sudden he stopped practicing. We live in a small town, so I was like, all right, like who's going to do musculoskeletal ultrasound for these athletes now? So, of course, we were like, well, we're going to do it. We're going to take care of the community.
Of
So,
course.
I had met you, Dimi, I think in Denver we were together, and you started telling me about this, and Electrodiagnostics was linked with our desire to do musculoskeletal ultrasound. So here we are now.
It's awesome. That's fantastic. Generally, how did your involvement in electrodiagnostics journey through becoming board certified and now as a board certified individual, part of the mentorship program of HODS, this has changed the way you practice manual therapy? And actually, I have to say that you went all in because you not only trained yourself, you trained literally your top team, all three of you guys. And I have to applaud you that three members of his top team, they all joined together the program and they all got board certified at the same time. This is like truly spectacular that you guys achieved. How has it affected the practicing of manual therapy for your patients?
The goal of our practice, and I know it aligns with your goal, and that's why I enjoy working together with the HODS organization, is to enhance the practice of physical therapy, to create an atmosphere where we are held in the highest regard. We are the first choice when patients have a muscle, joint, nerve injury. But to do that, we have to get patients better. And we have to get patients better on a consistent basis. There can't be just a good, practice here and a good practice there. Like we have to build our reputation up as a community. So the educational process that we went through with HODS is a different skill set than we got in physical therapy. I want to say it's close, but it's really not even close. Like the things that we learned through the HODS education and through being ECS certified has elevated our ability to treat these patients because essentially our whole system is based off of neural identification. We trace back where that painful segment is coming from to the spine, and we treat that segment to start with. So for us to be able to understand where the origin of that patient's pain is coming from with an electrodiagnostic test just has like sent our outcomes, sent our treatment plans, everything kind of through the roof. It has really paired well with our spinal mobilization system.
Describe to me what happens. I want to make sure that we all understand that what sounds for you and me elementary because we are doing it every day. For some of the people who are watching or listening that they have not practiced that, the combination of electrodiagnostics and manual therapy, the whole concept may sound a little foreign to them. Let's suppose that I come into the practice, come in with, and I complain of pain in my neck, radiating to the left arm, let's say, and I have also on and off numbness and tingling in my fingers. So that is how I present to the practice. So when that patient walks in to your office, what would be the steps that this patient will undergo?
For us, it's a clinical care issue. So we educate all of our practitioners that it is very, very important. If we are going to move toward being primary care physical therapists, we have to make appropriate referrals. Understanding that that patient that you just described comes in, we need to know right away what's going on with that patient.